Today I'll be performing cervical active range of motion in all planes with overpressure except with extension. I'll also be demonstrating upper quarter neurological tests and measures, including dermatomes, myotomes, and reflexes on a mock patient. I'll be demonstrating cervical active range of motion in all planes with overpressure except for extension. With Carlos here in supine position, I'll ask him to first perform active range of motion, then I'll add the overpressure. So to start with, I'll ask Carlos to go ahead and bring his chin towards his chest. Into cervical flexion here, I'll add overpressure in the end range of motion. Bring it back to neutral. And then here I'll have you go ahead and turn to the right as far as you comfortably can, adding overpressure into cervical rotation. Then we will do the same thing, looking towards your left, adding overpressure again to cervical rotation. And we'll bring it back to neutral, and then here I'll ask the patient to go ahead and bring your ear towards your shoulder into cervical flexion, and then adding the overpressure there. Same thing on your left side, bringing your ear towards your shoulder into lateral flexion, adding the overpressure there. Finally, I'll have Carlos look up towards the ceiling. I will not apply overpressure here due to the risk of provoking any vascular symptoms, just focusing on the active range of motion of cervical extension here. So cervical overpressure is used to assess true end range motion, determine the quality of the end feel, and help distinguish between muscular tightness from joint restriction. It is also used to see whether symptoms appear at the end range. During overpressure, key observations include symmetry of motion, overall movement quality, the character of the end feel, and whether pain, numbness, or radiating symptoms are reproduced. With Carlos in sitting position, we are now going to do a dermatomal assessment for the upper extremities. I'm going to use a cotton ball to provide that light touch sensation. During the lower extremity assessment completed earlier in the semester, John recommended testing the dermatomes on both sides simultaneously to better compare sensation and identify any asymmetries. The same approach will be used here. I'll go ahead and have Carlos close his eyes for me and report whether each area feels the same or different on both sides. So we'll go ahead and start with C2, which is the back of the head.
Same.
And we'll move on to C3, which is just on top of the collarbone.
Same.
Then we'll go ahead and move on to C4, which is the top of the shoulder, and I'm just applying light touch sensation there.
Same.
And then we'll move on to C5, the outer elbow.
Same.
Move on to C6, the thumb. Go ahead and gently apply the pressure there.
Same.
Then we'll do C7, which is our middle finger.
Same.
Then we'll do C8, which is our pinky or little finger.
Same.
Then we'll move on to T1, which is our medial or inner elbow.
Same.
And that should complete our dermatomal. Carlos in a sitting position, a myotomal screen of the upper extremities will now be performed. A myotomal screen is different from a manual muscle test. Instead of assigning a muscle grade, this screen looks at nerve root innervation and checks for weakness or difficulty maintaining a position. Each position will be held for about 5 to 10 seconds to see whether the muscle can maintain the contraction. The tests are usually performed bilaterally to compare left and right sides. For the sake of this video, I will not be holding the position for about 5 to 10 seconds. We'll just be quickly going. Move on to our myotomal screen. We'll start with C1, C2, cervical flexion. So I'll have Carlos go ahead and look towards the floor for me, and I'll add some resistance here, holding that resistance for about 5 to 10 seconds. However, for the sake of this video, we're just gonna go ahead and run through that. We're going to go ahead and move on to C3, which is cervical side flexion. Have him bring his ear towards the shoulder, adding some resistance there. Moving to the other side and doing the same thing, applying resistance there. Now we will move on to C4, which is shoulder elevation. So I'll have him shrug his shoulders for me, and I will apply some resistance there. Then I'll have him hold his hands out towards the side. We're going to go ahead and test C5 here, shoulder abduction, and then I'm going to go ahead and apply some resistance there. Awesome. Moving down to C5, C6, which is our elbow flexion. So I'm going to go ahead, have him flex his biceps there for me, and I'm going to apply some resistance there. Doing the same thing to the other side. Again, we would be adding the 5 to 10 second hold here. Alrighty, and then we'll move on to C6, wrist extension. I'll have you hold your wrists like so, applying some resistance there. To the other side. Then we'll move on to C7, elbow extension. I'll have him bring it up, and then I'm going to have you go ahead and apply some resistance against me. Doing the same there. Perfect. And then we'll move on to C8, finger flexion and thumb extension. We'll focus on finger flexion for this one. So I'll go ahead and apply some resistance there. Perfect, and then we'll move on to C8, thumb abduction. I'll be applying some resistance to his thumb. Perfect, moving on to the other side, applying some resistance there. Then I'll have you hold your hands out. We'll be testing T1, which is finger abduction. Applying some resistance there, not letting him close his fingers there. Doing the same thing on the other side. With Carlos in a sitting position, we will now move on to our upper quarter reflexes. Reflex testing helps identify how well the nerve root and reflex are functioning. Each reflex will be tested with Carlos relaxed, and the tendon will be tapped with a reflex hammer while observing for the muscle's response. The first reflex tested is going to be our biceps reflex, which corresponds with C5. So what we're going to do is we're going to go ahead and find our biceps tendon first. We'll again remind our patient to be fully relaxed, and then we'll go ahead and strike the tendon with our reflex hammer. Next, we'll move on to our brachioradialis reflex, which corresponds with C6. The brachioradialis tendon is located on the radial side of the forearm, just above the wrist. So I will go ahead and start on Carlos's right side. I'll have him relax his arm for me. I'll locate the brachioradialis tendon just above the wrist, and then here I'll lightly tap, again making sure he's relaxed for me. The final reflex we will be testing is our triceps reflex, which corresponds with C7. The tendon is located just above the elbow on the posterior side. So I'll go ahead and I'll grab Carlos's arm, and I will locate our triceps tendon. Once I have located that tendon, I will go ahead and lightly tap with my reflex hammer. Do it one more time. Neurological tests and measures are used when symptoms suggest possible nerve root involvement, such as radiating pain, numbness, tingling, weakness, or changes in reflexes. These neurological tests help determine whether a specific cervical nerve root may be affected. During neurological testing, the key findings include differences in sensation across dermatomes, weakness or difficulty maintaining positions in myotomes, and changes in reflex responses.